Hello, today we have Mark White, the CEO of Nexalin Technology, trading on the NASDAQ under the ticker NXL. Mark, welcome back.
Good to see you, Craig.
Good to see you, Mark. For those just hearing about Nexalin for the first time, what problem are you solving and what makes your approach unique in the mental health space?
So I'm solving a problem that we all know about. We all know somebody suffering with some type of a mental health issue, depression, anxiety, don't sleep, children with behavior, parents, Alzheimer's, dementia. So we're solving the global mental health epidemic. How are we doing it? Number one, we're drug free. That's perhaps the most important part of this. No more side effects, no more risk, no more low response. Number two, we're non-invasive, so we don't need to do any surgical procedures. Number three, it's a frequency-based treatment, so it's completely undetectable to the human body. Your brain and your body is full of electrical frequencies. We're going to use the same electric frequencies to talk to it. Now, perhaps the biggest difference, other than it being drug-free, non-invasive, it's 70 to 90% effective. That's a big deal in mental health treatment. So 7 out of 10 to as many as 9 out of 10 will go into complete remission or recovery from the symptoms that they've been associated with. Just think of a digital treatment, digital medicine with a digital distribution model. No more psychiatrists, no more hospitals. It's all done virtually through a digital ecosystem on your phone. Your diagnosis is on the phone. The treatment is in the privacy of your own home, and it's all monitored with your physician through the digital ecosystem.
Now, that third generation device, Halo, it's designed for both home and clinical use, Mark. Why is that flexibility important?
Okay, so I just ran through perhaps the greatest barriers to successful treatment: drugs, side effects, low response, etc. But what our research indicates, and what most of your audience will probably be aware of, is the next greatest challenge is the stigma. They don't want to get in the car and they don't want to go to the psychiatrist office. They don't want to get in the car and go to the mental health center. They don't want to get in the car and go to the emergency room. What they really want to do is pick up their phone, talk to a doctor, and get a treatment delivered to their front door. And then that treatment will be able to be monitored by the doctor through the virtual system on a cell phone with an app to a digital cloud server. So that's primarily where we're going. What we're doing here, for your viewers, I'm holding here the Halo headset. Just imagine now that you just get this delivered to the front door. You put this on your head, you turn on your cell phone, you communicate digitally with your doctor, and you receive your treatment at home. No more stigma, no more side effects, no more drugs. It's the future.
I want to dig deeper into your strong results, Mark. You mentioned 70% of patients seeing significant symptom improvement. What is next on the clinical roadmap?
Well, so that's just go through what you just said. 70 to 90% will find complete recovery within 2 to 4 weeks. And then from there, it's about managing the symptoms to keep you in remission, if you will. What's the future? So this is a brain-based health product. So the three areas that we believe are the most important right now, not only from a treatment standpoint, but from a business standpoint. Number one, what we call mood disorders. That's what most of your audience is very familiar with: anxiety, depression, insomnia. Number two, everybody knows that we have a suicide problem in the military. Everybody knows we have a traumatic brain injury problem in the military. And everyone knows that that's the result of PTSD, post-traumatic stress disorder. And those two areas are our primary focus up until about 3 months ago. And as far as what's next on the clinical roadmap is what's one of the greatest needs and is only going to get worse in the coming decades: Alzheimer's disease, early dementia. So what's the future? Mood disorders, military, TBI, Alzheimer's, dementia.
Mark, let's look at those articles that you've recently published on Alzheimer's and dementia. of course, how you're going to treat it with your technology. As everyone knows, there are really no treatments that offer Alzheimer's and dementia patients relief. And I think you'll agree, Mark, that this presents a fabulous opportunity for Nexalin. Can you tell me about your strategies for the treatment of Alzheimer's and dementia, and especially as regards approaching the FDA?
So, Craig, great word, strategy. So we want to be very strategical. So what I don't want to tell your audience is Nexalin has found the cure for Alzheimer's dementia. What we have now been able to validate clinically is we are able to slow the disease down. We're seeing a pause, if you will, on the cognitive decline. We're seeing a pause, if you will, on the onset of dementia. So with that, what we're doing is developing our strategy to be very specific on the types of clinical trials that we design, because obviously we're involved in a global business model or a global treatment model. But as we all know, the United States and the FDA for the treatment of Alzheimer's dementia, as you said, could be an enormous opportunity. So we're using a very specific strategy, small steps. We'll be releasing some new information. We have a lot of internal data, plus we have published data. And all the data is taking us in the direction of a application with the FDA for the treatment of Alzheimer's dementia at some point in the very near future.
Let's get into that addressable market again, Mark. Some experts say that Nexalence Tech could address a nearly $100 billion market. Tell us again about those big revenue opportunities for your company.
So really, we just basically touched on them. Let's separate out the military and the federal government and just focus on this. Think about a treatment that is 70 to 90% effective on removing challenges associated with sleep issues, depression issues, mood stability, anxiety issues, quality of life. Think about that. And the idea is that you no longer have to go to the psychiatrist. You no longer have to suffer side effects. You still have a medical cleared technology through the FDA where you have a relationship with your physician through the phone, through the app, through the cloud. So that is in itself just almost overwhelming. But then when you start talking about Alzheimer's and dementia, and the fact that they're predicting over the next 20 to 30 years that there'll be a 2 to 300% increase in the Alzheimer's dementia community. So these two areas alone are, as I said a moment ago, almost overwhelming to think about a technology that can actually stabilize in the areas I've just mentioned.
Walk us through your business model, please, Mark. How does Nexalin make money? Is it going to just be device sales, or are there recurring revenue opportunities as well?
Yeah, think of the razor blade model as the easiest way to say this, but more specifically, so we still have a clinical device, and then we're also going to have, as I mentioned earlier, the Halo device that can be used in the privacy of the home. Let's first talk about the clinical device. This is for patients that need actual oversight in a clinical setting by a medical professional. So that will be sell a device to the doctor. He then provides treatments, and each treatment has a single use disposable set of electrodes because this is a 40-minute treatment with an electrical pad across the forehead that administers frequencies, one pad behind each ear, single use set. There's your revenue long term. When you move to the Halo, to the headset, that goes directly to the consumer with a physician's order or subscription. And then from there, there is a subscription fee to be a part of the digital community that allows the device to be monitored and allows the consumer to have access to the device.
Final question, Mark. What is the essential value proposition? Why should investors take an interest in Nexalin right now?
Take a look at the company. Number one, as I just mentioned, think of the future of all mental health or the majority of mental health issues, including dementia and Alzheimer's, being tied to a digital frequency system that can be distributed in a digital, scalable market in the privacy of your own home that is safe, that is effective, that is drug free, non invasive. For everyone in your audience, that is the future. That is the future. This is state of the art medical technology to address up to 90% of the issues associated with every disease we've covered here. Number two, take a look at the valuation of the company today and look at the data that is starting to get published. Read the headlines associated with press releases, and you'll be able to actually, what I tell some of the communities that I visit with, they're like, so what's next? Get into my head, read my press releases at Nexalin.com, read some of the titles of the published data, and you'll see this is the future, and there's the opportunities to invest in that technology or in the future.
Mark, you've laid out a very compelling case as usual. Thanks for being with us.
Thank you, Craig.